And here with answers to your medical questions in our Ask the Doc segment is Dr. Msonthi Levine. Colonoscopies, a must get, but what age do we need to start getting those?
We normally start at the age of 50. If you've had strong family history, then we start about 5 or 10 years prior to that person, whoever was diagnosed at an earlier age. Such that if your mom was diagnosed in her 40s, we'd probably start in your 30s to look at that. And certainly the colonoscopy is still the gold standard. They still have the pill that you can swallow, but we don't use that for screening. They have stool cards, which you can do. You have to do that annually. And it's not as good as the colonoscopy because sometimes that will miss things. So we still recommend that for most people starting at the age of 50, or if you have symptoms, abdominal pain, severe constipation, rectal bleeding, those are some indications for a more immediate colonoscopy.
And a lot of people aren't really fond of the idea of a colonoscopy.
Yeah,
so what are some of those things that people can't get past thinking about a colonoscopy?
Based on what my patients say, it's really the prep that they have to drink for that. It's not really the procedure itself. I don't hear a lot of discomfort coming from the procedure. They use a slight sedation, but it's the prep, having to drink all the liquid, being up the night before, at the bathroom multiple times a day.
But are you really up all night long?
For some people, depending on when they start the prep, they can have a delayed effect and can keep them up throughout the night, unfortunately. Not everyone, but I hear that frequently. It's all about the prep, and they're trying to figure out ways to avoid that and get around that so you don't have to drink as much liquid, but they have to have a clean surface and be able to visualize the entire colon. That's why the prep is so effective. But certainly once you get beyond that, it's typically a piece of cake. You can still have complications during colonoscopies, but the risk is severely low, and we don't see them that often, but it's always possible.
Is there a pill you can take as opposed to drinking all of that stuff?
There are some other tablets. I'm unfamiliar with the names. I don't prescribe them as often. I think everyone's familiar with the liquid. I think that is the way most gastroenterologists try to go. I think there's some limitations, maybe an elderly person, or depending on what they're trying to see, they might go with some pills, but certainly they always start off with the liquid as far as I know.
So once you get past that, I mean, think of the alternative.
You
have to get past that and get the screening done, and you're preventing colon cancer.
Absolutely. It's just the same thing with mammograms. We talk about breast cancer screening all the time. A lot of ladies say it's very uncomfortable. They press your breast in between the two plates. So it is an uncomfortable situation for some, but we're trying to look for cancers before they get advanced. We have a lot of patients who get diagnosed with stage 4 late cancer. There's not as many options. They don't do as well. So that's what prevention and screening is all about, trying to find it before it becomes advanced, before you have symptoms. We have a lot more options. Patients typically do well. So it is a little painful and cumbersome, but the price is not, it's a small price to pay because we're trying to just prevent cancer, and that's the big idea.
It's all about prevention.
Absolutely.
All right, on to some of our viewers' medical questions. What does it mean when your nose turns blue on the tip, and it just does it sometimes?
A lot of times that could mean that the blood vessels in the tip of the nose have constricted, probably from this, the air, if it's cold outside, or if you have certain medical problems or medications. Most of the time it does reverse on its own, and it's no danger unless it persists for several hours.
Is there a way to boost the fat content in breast milk?
Not quite sure. I don't know that we recommend consuming a lot of fat during pregnancy or during breastfeeding. I think just a healthy diet is appropriate. I can't think of any advantage why someone would want to have more fat in their breast milk. Studies don't indicate any type of health advantage in that way. So,
okay.
Yeah.
Do all family members or anyone that is going to be around a newborn need to get the whooping cough vaccine?
I think they're really promoting that very aggressively right now. That's what I hear out in the streets talking to my patients who have young people in the area. Their pediatricians, obstetricians are making them get the whooping cough, and we're also recommending that for patients 65 and above, and we also stress if you are around kids, then that is more important for you. Absolutely.
All right, we've got lots of other questions. We'll get to those in just a minute, so don't go away. Dr. Levine will answer more of your questions next on Live at 5. Well, we're back with Dr. Msonthi Levine to answer more of your medical questions. This one is a 51-year-old man. He has an aneurysm on an ascending aorta. He wants to work out, lift weights, but what are his limitations?
I'm not quite sure exactly. 51 is quite young. Certainly that's a dangerous condition to have, an aneurysm, dilation of the aorta, the main blood vessel in the body. Certainly the concern is rupture of that blood vessel, which is normally life-threatening, immediately a medical emergency. Most people don't survive that sort of thing. So normally I would probably refer or defer to the cardiologist or the cardiothoracic surgeon that's working with him. Typically you want to keep the blood pressure down, you want to keep the pulse down. We certainly want people to be physically active, but probably not anything strenuous, triathlon or
lifting
marathon.
weights.
You know, lifting weights, I'm not quite sure. I think if it's not too excessive, I think would be okay, because again, we want people to be in some sort of physical shape. Probably yoga would be okay, but certainly not anything very, very strenuous or highly intense. I think that would stress the body out too much.
Okay. A 63-year-old woman is taking cholesterol pills. Is there a limit to how long she should take them?
You know, we don't know. That's a debate right now. There's a lot of controversy with cholesterol management right now based on some new guidelines that came out several weeks ago. Physicians are kind of deciding how they want to manage that. But certainly as you get up in age, the risk factors of these medications start to factor in the toxicity, and actually the studies are not there as well as they are for patients in their 50s and 60s. A lot of these studies were not done in elderly patients, so we're kind of extrapolating these results. I think you just have to talk to your physician and have a one-on-one conversation and decide for yourself, do you think this is a medication for you or not? I think if you're in your 80s, 90s, you haven't had any significant diseases that require cholesterol medicine, probably stopping is not a bad idea.
With cholesterol medication, don't you typically go back to your doctor every 6 months to a year to see how that cholesterol medicine is working for you?
Yeah, we would like patients, two patients are busy. A lot of times it's difficult for them to come to the office, but absolutely every about 4 months or so we like to repeat the cholesterol lab, check the liver function to make sure they're not having any toxicity, and see where they're at. Certainly counsel them about diet and exercise, lifestyle modification, try to eat more of a plant-based diet, leave a lot of the meat alone, because that is what raises the cholesterol. So certainly you need to have those regular routine follow-up visits to see where the cholesterol is going.
Okay, a 19-year-old woman has a cyst on her spleen. Can that make you lose weight?
In my opinion, no. It can sometimes get large enough and cause a mass effect, and patients can start having abdominal pain or maybe some loss of appetite if it's causing mass effect on the stomach. But I don't see that actually that often, and certainly cysts typically are benign. They do not have to be removed. The spleen is a very important organ, so we typically like to leave that alone if we can. Okay.
57-year-old man, he wants to know, are there any pills that will help with concentration?
At this point, no, we don't have that. But again, we stress so much lifestyle on this show. There's tons of evidence, tons of research indicating that diet and exercise are extremely important in helping you concentrate, helping you preserve your brain function, reducing your risk of dementia and other illnesses like that. So not necessarily a pill, but a lifestyle.
All right, so think about that.
Absolutely.
All right, Dr. Levine, as always, we appreciate you stopping by and answering our questions. And you can always visit our website and see the answers to these and other medical questions posted online. And if you'd like to have Dr. Levine answer your medical question, you can always mail us at the address listed on your screen, fax us 892-7305, email us at laf@kftm.com, or you can post those questions every Monday on our KFTM News Facebook page.